Top 20 Hospital Receptionist Interview Questions and Answers. Hospital receptionists are the first point of contact for patients, visitors, and medical staff, making their role critical in healthcare. Interviews for this position assess communication, organization, and the ability to remain calm under pressure. Employers want candidates who can provide excellent service while handling sensitive situations. In this guide, we'll explore the top 20 hospital receptionist interview questions with detailed answers to help you prepare, build confidence, and secure your role. 1. Why do you want to work as a hospital receptionist? I want to work as a hospital receptionist because it combines my skills in organization and communication with my desire to help people. I enjoy interacting with patients and providing support during what may be stressful times. This role allows me to make a positive first impression, ensuring patients feel welcomed and cared for. Working in healthcare also gives me the opportunity to contribute to an important sector that directly impacts community well-being. 2. What skills do you think are most important for a hospital receptionist? The most important skills include excellent communication, strong organization, and the ability to multitask effectively. A hospital receptionist should remain calm under pressure, demonstrate empathy toward patients, and maintain confidentiality at all times. Technical skills, such as managing scheduling systems, handling phone calls, and processing patient information accurately, are also crucial. In addition, problem-solving skills and the ability to work well in a team are essential for ensuring smooth hospital operations. 3. How would you handle a distressed patient at the reception desk? I would remain calm, listen actively, and show empathy toward the patient's concerns. Acknowledging their feelings is important to build trust. I would then reassure them by explaining the process clearly and offering assistance promptly. If necessary, I would involve a nurse or relevant staff to address urgent issues. My goal would be to de-escalate the situation, provide comfort, and ensure the patient feels supported and prioritized in a professional and caring manner. 4. How do you prioritize tasks when the reception area is busy? I prioritize tasks by focusing first on urgent patient needs, such as emergencies or time-sensitive appointments. I then manage incoming calls, schedule requests, and administrative tasks in order of importance. Using time management skills, I ensure each responsibility is handled efficiently without compromising service quality. If necessary, I seek support from colleagues to divide workload. Clear organization and staying composed under pressure help me manage multiple responsibilities smoothly and effectively during busy times. 5. How would you maintain confidentiality as a hospital receptionist? Confidentiality is crucial in healthcare. I would ensure patient information is only shared with authorized staff and never discussed publicly. Documents would be stored securely, and I would follow all hospital policies on data protection. When speaking with patients, I would use discretion and avoid sensitive discussions in open areas. By strictly adhering to confidentiality protocols, I help maintain trust, protect patient rights, and uphold professional standards required in a hospital environment. 6. How do you handle phone calls in a professional manner? I answer calls promptly, with a polite and clear greeting that identifies the hospital. I listen carefully to the caller, address their needs, and provide accurate information. If I cannot answer directly, I take detailed messages or transfer the call to the appropriate department. I remain calm and courteous, even when calls are challenging, ensuring professionalism is maintained at all times. Effective phone handling leaves callers feeling respected and well-assisted. 7. How do you deal with a situation where two patients arrive at the same time? If two patients arrive simultaneously, I acknowledge both promptly and ensure they feel seen. I would quickly verify their appointment details and prioritize based on urgency or schedule. While assisting one patient, I would politely assure the other that they will be attended to shortly. Clear communication and efficient processing help prevent frustration. My goal is to maintain fairness, professionalism, and a calm atmosphere while ensuring smooth patient flow. 8. What steps do you take to stay organized? I use scheduling tools, appointment systems, and checklists to manage daily tasks efficiently. I keep the reception area tidy to prevent confusion and ensure important documents are accessible. Prioritizing urgent tasks and planning ahead helps me stay on track. I also allocate time for unexpected issues that may arise. Staying organized allows me to deliver consistent service, reduce errors, and manage multiple responsibilities effectively in a fast-paced hospital environment. 9. How would you handle an angry visitor? I would remain calm, maintain a professional tone, and avoid reacting emotionally. I would listen to the visitor's concerns, show empathy, and acknowledge their frustration. After understanding the issue, I would provide clear information or direct them to the appropriate staff for resolution. If the situation escalated, I would follow hospital protocols and involve security or management. My priority is to de-escalate conflict, ensure safety, and uphold a professional and caring approach. 10. How do you ensure accuracy when scheduling appointments? I ensure accuracy by double-checking patient details, verifying dates and times, and confirming information with the patient before finalizing. I use hospital scheduling systems carefully, ensuring no overlaps or errors occur. If changes are required, I immediately update records and notify patients. I also document all updates clearly to avoid confusion. By being detail-oriented and thorough, I reduce the risk of errors and ensure smooth appointment management for patients and staff. 11. How do you handle confidential paperwork? I handle confidential paperwork by ensuring it is properly stored, filed, and accessible only to authorized staff. I avoid leaving documents unattended at the reception desk and immediately process or secure them. When disposing of sensitive materials, I follow hospital procedures, such as shredding. I also handle electronic records with care, logging out after use, and protecting access. Respecting confidentiality is vital to building trust with patients and maintaining professional standards. 12. How would you deal with overlapping demands from doctors and patients? When faced with overlapping demands, I prioritize based on urgency and importance. For example, urgent requests from doctors regarding patient care would come first, while routine tasks could be managed afterward. I communicate clearly with both doctors and patients, setting realistic expectations. By staying calm, organized, and flexible, I ensure both parties feel respected and supported while balancing their needs efficiently. Strong prioritization ensures smooth workflow and effective service. 13. How do you ensure patients feel welcomed at the hospital? I greet every patient warmly, with a smile and professional tone. I address them respectfully, provide clear instructions, and assist with forms or directions. Showing empathy and patience is important, especially when patients are anxious or unwell. By being approachable and supportive, I help create a positive first impression. My goal is to make patients feel valued, respected, and comfortable from the moment they arrive at the hospital. 14. How do you manage stress in a hospital environment? I manage stress by staying organized, using time management skills, and maintaining a calm mindset under pressure. I focus on prioritizing urgent tasks while taking short breaks when possible to recharge. I remind myself of the importance of my role in supporting patients and staff, which keeps me motivated. Effective teamwork also helps reduce stress. By staying positive and resilient, I maintain professionalism and deliver quality service even in demanding situations. 15. What would you do if you made a scheduling error? If I made a scheduling error, I would take immediate responsibility and correct it promptly. I would contact the patient to apologize and reschedule at the earliest convenient time. I would also inform the relevant medical staff to ensure they are aware of the adjustment. To prevent recurrence, I would review what caused the error and implement strategies, such as double-checking details. Transparency and accountability are key to maintaining trust and professionalism. 16. How do you ensure teamwork at the hospital reception? I foster teamwork by maintaining open communication with colleagues and offering support when workloads are heavy. I share information promptly to avoid miscommunication and respect each team member's responsibilities. By being cooperative, dependable, and flexible, I contribute to a positive work environment. I also encourage collaboration during busy times to ensure patients are served efficiently. Effective teamwork ensures smooth hospital operations and improves the overall patient experience. 17. How do you respond to last-minute appointment cancellations? When a patient cancels last minute, I update the scheduling system immediately and inform the relevant department. If possible, I fill the slot with another patient on the waiting list to maximize efficiency. I also note the cancellation to track patterns in case follow-up is needed. Handling cancellations promptly ensures minimal disruption to schedules and allows the hospital to continue operating smoothly while maintaining excellent service for patients. 18. What experience do you have with hospital software systems? I have experience using hospital and office software for scheduling, patient records, and communication. I am comfortable learning new systems and adapting quickly to updates. I pay attention to accuracy when inputting information and ensure data security is maintained. Software tools help streamline operations, reduce errors, and improve patient service. My technical proficiency, combined with attention to detail, ensures I can use hospital systems effectively to support both staff and patients. 19. How do you handle multiple phone lines ringing at once? When multiple lines ring, I answer each promptly in the order they arrive, ensuring no call is left unattended. If necessary, I place callers on hold politely while addressing urgent matters first. I keep messages concise and transfer calls quickly to the appropriate departments. Staying calm and organized is essential in these situations. By managing multiple calls efficiently, I ensure professional communication and reduce wait times for patients and visitors. 20. Where do you see yourself in 5 years in this role? In 5 years, I see myself as an experienced hospital receptionist who has developed strong administrative and patient service skills. I hope to take on more responsibilities, such as supervising reception staff or contributing to process improvements within the hospital. I also aim to expand my healthcare knowledge and potentially grow into a medical administration role. My long-term goal is to continue supporting patients while contributing positively to hospital operations. Preparing for a hospital receptionist interview requires demonstrating professionalism, empathy, and organizational skills. By practicing these common questions and tailoring your answers to your experiences, you can confidently showcase your suitability for the role. Remember that your ability to remain calm, handle sensitive information, and provide excellent service will set you apart. With preparation, you'll be ready to make a strong impression and secure a rewarding position in healthcare administration.